Good evening, everyone. I hope that you can hear me. This is the webinar for the Civil Society WASH Fund, Knowledge and Learning, and we are talking tonight about civil society and local government working together for sustainable WASH services. Maybe just to get us started, I said good evening, good morning for some people as well. To get us started, just make sure that you can all hear what I'm saying. There's on your little GoToWebinar bar, there's a little hand icon next to you should be able to see it next to your name. If you could please press that, and so I can know that you are hearing me clearly. That is also the hand that icon you will press when you want to ask a question or you wish to speak later on this evening. So far I can't see many hands. Could you please click on that icon to show that you can hear me? Okay, some hands are appearing now. Thank you. That's good. I think most people can hear me now. That's great. The other thing, just in terms of how this webinar works, if you would like to ask some questions, there is a questions box where you can type the question into, and also a chat box where you can chat to all of the people in the session. The format will be that we will have a number of presentations, and then there'll be time for discussion after those presentations. Also, please mute yourself while you are listening. At the moment you're all muted by the organiser, which we'll keep it that way for now until the presentations are complete. Additionally, if you are hearing feedback, you might want to try with a USB headset. If you do have any technical difficulties while this is occurring, please email us on that email address there, or you can visit the GoToWebinar site. That's also listed there. So the agenda for this evening, obviously introduction by myself. I'm Bronwyn Powell. I'm the Knowledge and Learning Manager for the Civil Society WASH Fund. We then have a presentation by Harold Lockwood, which is on the lead topic, Civil Society and Local Government working together for sustainable WASH services, and then a presentation on a particular case study by Mark Harper from Velthungerhilfe in Zimbabwe. Then we'll have plenty of time for discussion with Harold Lockwood facilitating, and that's also the chance for you, if you are attending the upcoming regional learning event in Southern Africa and in Harare, to give us your ideas about what particular issues you would like to see covered there. And that will be incorporated into the program, which is currently in draft form. Then we'll wrap up. So to continue, just briefly, looking at knowledge and learning in the Civil Society WASH Fund, the purpose of the knowledge and learning component of this fund, which includes 13 CSOs in 29 countries, is for information sharing. So we do have a website and we produce newsletters to stimulate debate, like tonight's webinar and a number of other forums we run, improving WASH practice, encouraging adoption of evidence-based good practice, and contributing in this way to the WASH body of knowledge. We also support innovation through the Innovation and Impact Fund, and if you do have outputs that you would like to share with us or include on the many resources we already have on our website, please do email them through and we're very happy to share them. The team tonight, myself, Bronwyn Powell, we have Harold Lockwood, who will be our first presenter from AgriConsult, Mark Harper from Velthungerhilfe, and Selena Liston is our Technical Support Program Coordinator here in Australia as well. So without further ado, I will hand over to Harold for our first presentation.
Okay, thank you, Bronwyn. I hope everybody can still continue to hear me while I just bring up this PowerPoint slide. I assume that everybody can, and it's morning time here, so I suppose we should say good morning to people. Right. Okay, thanks again, Bronwyn. I think it's a great opportunity to start to build on the some of the inputs we've had on a bit of an e-discussion, working towards then the event, as Bronwyn said, which will be held in Zimbabwe in a few weeks' time. So the point of this first presentation is really to frame some of the big picture issues, I think, that we see in this complex process of delivering water, sanitation, hygiene services at the local level. So I'll be picking up on what the role of government, local government particularly, is in these processes, along with other actors, of course, and then reflecting on some of the issues around the delivery of aid and the role of international aid itself, but also the role of CSOs that are involved in delivering such inputs and such investment. And some of these issues you'll see will be picked up subsequently by Mark Harper, who's speaking about the case in Zimbabwe. So I think this is the chance to put in place some of these bigger issues. I'm not sure if the screen is actually scrolling down now. Sorry folks, just seeing to see if there's a screen set up. Okay, so what I'll have to do is walk these through slide by slide like this. So thinking about just wash service delivery in general, I think this is an issue which has now been broadly recognised in terms of keeping services going in the long term. This recognition that we have a twin challenge, and particularly I think in the region we're dealing with in Southern Africa and the 4 countries in the WASH fund there. There's one challenge of delivering that new infrastructure, building new systems, that capital investment, but another challenge in terms of keeping those systems running over time. And we know that in a number of countries in the region we have pretty low levels of sanitation coverage, particularly rural sanitation, at or under 30% in those 4 countries, and urban sanitation rates also pretty low. So we know that there is this challenge, almost this tension between at the same time building infrastructure and putting in services in place for first-time access, and actually then maintaining and managing that. We also know that this process involves a complex set of elements that need to be in place in order to make that happen. And that goes beyond that first initial investment in capital. It requires good management, operation and maintenance, particularly monitoring of services, and those that are providing those services, so the operators themselves, which is linked to this whole issue of giving voice to consumers and citizens, which is increasingly important as those service levels improve over time. We know that some of the elements of this equation are in place, so we know we have quite good experience in some of these elements, but we know others are weak or even non-existent at all. So, for example, regulation in the region in many of the countries is not formally established, an independent regulator, though Mozambique is a significant exception in that sense. We also know that there are financing problems, and meeting investment is a big challenge in terms of the long-term costs, also particularly around developing viable business models. And finally, we see that there can be a disconnect between organizations that come in and build systems, whether those are from international NGO partners or indeed government contractors, and those that are in the end responsible to manage and maintain those systems. I'm not sure if people can see the changes on the screen. It doesn't seem to be working so well, so I'm going to again go back and try and work this through manually. Thinking about the role of local government then in this whole complex, and we know that this is a process of collective actions, and no one organization can manage to do all of those things, but it's increasingly the fact that decentralization is here. We're living in a more and more decentralized world, and many of the countries, in fact all the countries in the region we're looking at here, have some kind of legislation in place, legal acts that establish decentralized government, although there's varying degrees in process in terms of the depth of that decentralization, but also the extent to which it's been established. And as part of that decentralization process, water and sanitation are, along with other basic services such as health, education, electricity and so on, are regarded as something that should be ensured at that local level. Doesn't mean that local government necessarily has to do everything, but they should ensure that it is occurring. And in some instances, local government is in fact a direct provider of the services, so there can be a situation with a conflict of interest in terms of their role vis-a-vis those services. Whichever routes that is taken to decentralize, and there are three broadly recognized routes: deconcentration, delegation and full devolution, the sort of most extreme form of decentralization. It's clear that there are these three broad levels of relationships between central government at the highest level, local government at the decentralized level, and then the service provider functions on the ground, as it were. I think it's clear that in a lot of countries the authority to provide services, that legal authority, is passed down to the decentralized level, where a lot of important functions are carried out around planning, financing, including trying to raise finances at the local level and setting out bylaws for setting the rules of the game, if you like, in terms of the functioning of service providers and operators. Also, asset management for the responsibility for asset management is sometimes passed down to this level to local government, who are supposed to then ensure that assets are taken care of and invested in over time. And at the lowest level, you have the operators, which may be public, private, or a mixture, can include community management, particularly rural areas, and also a role for private sector itself. So I think that's fairly clear, those three levels. We can see those in the different countries in the region, and they're important to recognize that those accountability lines are clear. When it comes to the role of local government, I think there are particularly some opportunities. Obviously, they're closer to the electorate, closer to the citizenry at that level, and we know in theory they can play an important role. And one of those, particularly just to highlight, is around accountability. So without any kind of third-party consumers or users of a service such as water or sanitation have only a direct relationship with the service provider. So they pay for a service and they receive it. If it's a poor service, if the tariffs are set at a too high level, there's not a lot they can do in terms of raising issues to address that. By introducing the authority at the local level, the local government level, and in the absence of a formal regulator, we can then see a type of regulation oversight of services, which is pretty important in terms of protecting the interests of consumers, holding service providers to account, and also that consumers themselves, citizens, can exercise their rights, their legal their legal responsibility in terms of holding the service authority also to account. So it creates what is called commonly a long arm of accountability, and it's a very important role, I think, for local government that it's increasingly playing and should be important. So in theory, we see that decentralization is agreed in many countries that it's a good thing, that there are these conditions in place for local government to perform its functions, that there are mandates passed down, the money goes down, that there's capacity to do the work. But I think what we'll all recognize, and I think particularly those CSOs working in the Southern African region will also clearly recognize that there's a big gap sometimes between that policy position, the theory, and the practice, and particularly around the relationship between central government ministries and local governments, whereby there's sometimes resistance in terms of handing over that full responsibility, the full accountability for decision making and financing. Sector reforms can be uneven. There may not be clear lines of accountability and responsibility between these different levels. And as I mentioned briefly in the beginning, fiscal decentralization is often limited and doesn't necessarily follow that transition of mandate down to the local government level. So money may come in, but it may be late, it may be unpredictable, it may come in lumps at the end of a financial year. And also local governments often struggle to raise revenue at the local level in terms of local taxation and income. And we know that capacity is a big issue. I think we'll see some of these constraints in the presentation from Zimbabwe, and also ways in which we try to overcome those capacity constraints. Just to illustrate this is data from the JMP or the GLASS report from 2012 showing responsibility for sanitation service provision, and out of 64 countries that responded to this in the GLASS report, only 40% had the corresponding financial decentralization along with that operational mandate being passed down. So that's a pretty stark evidence to show that it doesn't always follow that the money comes with the responsibility. Thinking about the role of international aid in general terms, and how this can support or in fact sometimes undermine development efforts on the ground or in country, we know that aid itself can be short-term and can be subject to political influence. It can be stopped, programs can be stopped for sometimes very seemingly obscure reasons. We know also that there's pressure for results from donor countries, populations in the north, where there's been, for example, the last 5-8 years, a lot of pressure on budgets in donor countries, and people are demanding, at least for the aid that they're giving, some kind of tangible output. So there's much more focus on numbers, being pressured to produce numbers, rather than thinking about some of the systemic support issues and capacity issues that can lead to the outcomes which we know are required to keep services going. And to achieve that, sometimes the quickest route is to bypass government. So it's just easier to go and do things yourself as an organisation, rather than take that route through working with government. And where government doesn't have a strong coordination mechanisms in place and leadership in place, then the danger is you get fragmented approaches, different organisations going off, doing different things with different implementation approaches, which can create a bit of a mess on the ground. And that was one of the issues picked up in the discussion we have had in the last couple of weeks. But of course, I think it's improving. There has been a lot of effort over the last decade to try and improve the way aid is delivered and improve the alignment and harmonization of aid at a macro level, and that is evidenced by the emergence of sector-wide approaches. There's more in the way of joint sector review processes, so it is changing, and it's changing in a positive direction. However, I would argue that when we get down to the local level, there are still quite a number of challenges. You may have these more macro level agreements about how aid flow should work, but on the ground there's often an unequal relationship in terms of programs managed by CSOs and local government itself. They have the resources, they have in effect power to get things done in a way that local governments can't. They often channel money in parallel to local government systems, and there can be this struggle to coordinate disparate actors at the local level, particularly around enforcing norms and standards, technical designs, even approaches to tariff, that kind of thing, and thinking of subsidies around sanitation and CLTS. Of course, there's a lot of good things that CSOs can do and can bring learning from the outside and can bring scarce resources to innovate and test and scale up. I think the challenge is reaching a balance, particularly in recognizing that resource scarce environment under which a lot of local governments do work. So I think probably a number of you have seen examples of high-tech monitoring systems that have been brought in with rely on a lot of internet connectivity and so on. And once that funding dries up, local government just can't continue with it. It just doesn't have the resources to be able to maintain those systems. So it's about balance, and it's about recognizing the constraints under which local government actually works. So where does this all take us in terms of some closing thoughts on the role of civil society organisations and working with local government? And I think there are a lot of positive things that can be done, but in the medium to long term, I would argue that there are two areas in which CSOs could focus on. And the first is to transition their role from one of more direct implementation, albeit through partners on the grounds, national partners, but to think more about this catalytic role, and particularly around capacity building of local government, which would also include at that local level the private sector, bringing in some of those business models which can help particularly peri-urban and small town systems work better. And this question of aligning and supporting government systems and reforms is really important. I think in the medium to long term, really it's the only exit strategy for these large-scale donor funding programs is to see local government built up and as the rightful mandated organ of the state to be able to deliver services effectively or to ensure their delivery. The second area, I think, which is very important, and we have examples of, and I'm sure in the workshop in Zimbabwe we'll see some examples of these, is to focus on the accountability functions and holding government to account, sort of helping communities and users to express themselves and to demand their rights on the one hand, but also holding governments to account in the north, in donor countries, to follow through on commitments and even to influence the way in which aid is delivered. So moving away from that constant focus on numbers and towards investment in systems and capacity which can help in the long term. Strengthening public and parliamentary oversight bodies in countries in the south is also an area which I think could be an important role in terms of having permanent accountability structures in place. And then, as we mentioned before, in terms of innovation and documentation of new ways of working within an accepted and a recognized framework of innovation and not just trialing things left, right and center. So I think in terms of future roles, that's where I would see the relationship going. One of the big issues and the big questions in all of this, of course, is public financing. So if the funds that come along with these kind of CSO programs are to be able to pull out public financing, other sources of revenue have got to be able to be built up to take over and be able to continue to invest in services. So this is a long-term sort of vision, and I think it would be great to hear your feedback on these points, and we'll learn more about specifically what the CSO WASH Fund partners are doing in some of these areas. Thanks, Bronwyn. Back to you.
Thanks, Harold. We're now going to go to Mark, who'll give a presentation from Welthungerhilfe in Zimbabwe.
Hi. Hi everybody, greetings from Zimbabwe. As Bronwyn says, I'm Mark Harper. I'm the project manager for the SELF project, which is funded by the Australian government. SELF stands for Sustainable Services for Everyone Beyond the Lifetime of the Project at a Fair Price. Just to give you a brief background of Zimbabwe, Zimbabwe suffered 10 years of, I would say, economic ruin from around 1999 to 2009, and although the economy has stabilized since then, we're not really growing at anything more than a very low rate, and certainly very low compared to our neighbors in the region. The economic decline had a big effect on the water and sanitation sector. And in 2008 we had a large cholera outbreak for the first time in 30 years with large numbers of cases and deaths. And the cholera was mostly urban based, and which has directed our project design. In Zimbabwe, we're noting that the local government's ability to deliver services has decreased over that period, and consequently a lot of the efforts that the civil society organizations and World Bank and UN do is to really support local government to deliver services. And maybe just also to say from Harold's presentation, we don't really have that triangle structure in Zimbabwe. In most cases, local governments are the service delivery agent, and where they're not, where national government provide a service, there isn't really any accountability structure, that accountability function that the local government plays. Our project has a theory of change. We get money from the Australian government, and Weltunga Hilfe leads a delivery team of 7 partners, which include 4 local NGOs, the Institute of Water and Sanitation Delivery, and GRM Zimbabwe, who oversee the knowledge, learning and monitoring of the project. The delivery team works with what we call transformation agents, who are basically local authorities, as well as the Zimbabwe National Water Authority and some other ministries at sort of district level. And then we also work with some community champions, community health clubs and other community leaders as well to transform water and sanitation practice in the community. And so by working with the local government and ministries at district level, as well as these community champions, we're anticipating a change in water and sanitation service delivery and practice among the target population. We're focusing on 19 small urban centers in Mashonaland West Province in Zimbabwe. So our project is urban based, although not in the larger towns. So the approach that we take in the project is, first of all, we have placed staff in each of the local authority offices. We have placed about 20 staff across the 10 different local authorities that we work with. We initially undertook a strategic planning process with each of those local authorities, specifically around delivery of WASH services. So each of the local authorities now has a strategic plan for the next 5 years. We also undertook a capacity and needs assessment of each of the local authorities, and from that we designed a training plan. We currently do trainings at local authority level, including other staff from ministries in that district. And from those trainings, we roll out those trainings to the community, or the local authority rolls out those trainings to the community. So that involves a lot of community-based planning around that. We've put the bullet in there, hardware as a carrot. So out of the 9 million Australian dollars which we have been given by the Australian government, 3 million is set aside for hardware, and that is really to improve the local authorities' engagement in the project and to get them enthusiastic about it, and also to improve their service delivery and their ability to collect revenue. We have a strong M&E focus within the project, especially linking a little bit to what Harold was saying about accountability. We in the project try to give the community a voice to inform the local authority about where service delivery is good and bad. We also encourage the local authority themselves to have a good handle in terms of monitoring their performance. We have a strong gender and social inclusion focus within the project, and I think overall the project is really focusing on making sure that the local authority has ownership and is accountable to the people that it's serving. So in terms of what we feel is working well in the project is very well accepted at all levels, nationally, at provincial level, at district and community level. We see high appreciation of the training program that we have implemented, and we see that this in some cases has resulted in immediate changes. That picture there shows a wheelchair ramp that was put in immediately after some gender and social inclusion training that we did, and that was done without any resources from us. The civil society organization staff who are stationed in the local authority, that model has worked very well, and it's highly appreciated by the local authority in terms of improving their capacity, and those staff have blended very well with the staff that are hosting them. We also see that the community are excited about the project. They're excited about about service delivery improving, and they're excited about being able to have a voice to give back to the local authority. We also see that during the rollout of the trainings, identifying community champions and enabling them to spread the learning that they're getting through the trainings is also a methodology which is working very well. Some of the challenges that we're facing, linking again to what Harold has been saying, when we wrote the project proposal in 2013, the economic outlook for Zimbabwe was remarkably different and looked to be going in an upward trajectory. However, since 2013, we've really seen that the economy has stagnated, and particularly for the more rural areas, local authorities are getting poorer and their ability to raise revenue is decreasing. We also experience within some of the local authorities that staff, because of this project, are expected to do extra work, but they don't receive any reward from the project, and indeed their situation is getting worse in terms of they are being paid salaries late, and as a result are demotivated. We've also seen lower than expected capacity within local authorities to produce water and sanitation design and to procure material, and that has resulted in us having to do some redesign in terms of having to engage extra staff to oversee the design and procurement process to assist them to achieve the standards that we need. And then finally, something which is affecting everyone who's spending Australian dollars, I'm sure the rate of the Australian dollar to the US dollar has gone down significantly since the beginning of the project. That's the end of my presentation, so I'll hand back to you, Bronwyn.
Thanks, Mark. Thanks for that. I think we do have a question to start us off from Tom Rankin from Plan. Thanks, Tom. Which is that he's particularly interested to know more about the hardware carrot. I think that was in your presentation, Mark. Perhaps you could talk a bit more about that, if you don't mind.
Sorry, you broke up there, Bronwyn. You want me to explain what hardware as a carrot means?
Yeah, Tom's got a question about that. If you could talk a bit more about that. I think you particularly mentioned something about you providing hardware to the local authority, which is, I gathered, was also about billing systems, because you talked about the increased ability to collect revenue as a carrot.
Yeah, I mean, we wanted to ensure that local authorities have improved capacity to deliver their wash services. So some of that includes need to repair hardware or to extend reticulation systems or to provide a better public toilet service, things like that. So it's just, I think it's more about the balance of the hardware within the fund, that we made about 30% of the money available for hardware, and so just to reflect that we're really fussy of the local laws to design and to manage systems rather than putting most of the money into actual hardware itself, which they may not be able to manage afterwards.
Thanks for that. Can you also see that chat box, Harold and Mark, where the questions are appearing? There's quite a few questions appearing now, which is great. There's one, any differences in the uptake success of the approach when, oh, they're coming in so quickly, they're moving up my screen. Any differences in uptake of the approach when looking at sanitation in comparison to water? I guess that means uptake by local government, if there's a difference in the effectiveness working with local government in water versus sanitation. Harold, would you like to comment on that?
Sure. I can't see the questions properly. That's the only problem, Norman. I'm not quite sure why. I think in terms of sanitation and the difference, I would say that probably there's more challenge, particularly with implementing CLTS, which is now becoming more and more widely adopted and even started to be integrated into policy in terms of the approach to sanitation and the kind of skills that it requires in terms of social marketing, understanding social marketing as an approach would be more challenging for local governments than a traditional subsidy-based hardware provision approach in sanitation. Less so in water. I think that's something that local governments have pretty good experience with globally and in general know what needs to be done, maybe not having the resources. So I would say yes, it would be more difficult or challenging working with that model. Not in all cases, but I think it's that would be more challenging for sure. Maybe could you copy and paste the questions or the key ones, please, Bronwyn?
Yeah, I'm just attempting to do that now. Did you have a response to that question as well, Mark, about the uptake being different for water versus sanitation?
Where's that one?
Number 3, any difference in uptake success when looking at sanitation?
I would say it's too. I'd say it's too early to give an answer to that at the stage we are in the project about which is going to be more successful. But in terms of prioritization within the project, we did focus more on water than sanitation, apart from construction of public toilets. So the two main parts are making sure that people can get water, because without water then sanitation is much more difficult to achieve. But also we're focusing on trying to create open defecation-free small urban centres, and the public toilets are a vital part of that.
Great, thank you. The next one was about the local authority staff and their motivation to support the project, which I think goes to your talk again, Mark, about the demand extra motivation or allowances. So I guess the question is, how are you perhaps dealing with that one? That's from McPherson.
Your error is what?
McPherson.
Where your error was collaboration between providers.
This one? Yeah. No, I don't think that's not from McPherson.
How are I'll read it out. How are the local authority staff being motivated to support the project, as most of them demand extra motivation or allowances?
Okay, thanks. I mean, I think for us that's a key challenge that we have. We don't pay allowances or extra top-up salary. We rely on the fact that they're getting trained through the project, and just that they're more able to do the job that they are engaged to do at the local authority level by being part of the project. It has resulted, like I said in the presentation, in some difficulties here and there, but we think that by introducing temporary motivation with increased salary or something like that is unsustainable and will result in problems after the project is finished.
Maybe just to also step in, Bronwyn, that this is a very common problem we see in many countries in terms of short-term incentives, sitting allowances, attending meetings or workshops or whatever, which actually then basically just supplement salaries. Ultimately, I think it comes to addressing some of these public administration terms and conditions, which is a long-term process, but it's a little bit outside the sector. So I think we tend to think of siloed, what are we facing in our particular water and sanitation sector, but these are the question of salaries, incentives, pensions, the whole package for public employees goes, of course, much broader than the water and sanitation sector. And I think there's no easy answer, and it's refreshing to hear from Mark that they've decided not to go down that route. Providing other kinds of non-monetary incentives is difficult, but it can work. So whether that's training or whether that's some kind of recognition somehow within a local context, and even trying to recognize and showcase successes nationally. So within a ministry or going up to national level saying, look, these good things are being done. It provides some kind of non-monetary incentive for people, but it's unquestionably a difficult tension to balance.
Yeah, maybe I can just come in there and say, I mean, we do support in other ways at the local authority level, so things like internet connection and access to computers, things like that. Again, non-monetary incentives, which we think are important and are appreciated at the local authority level.
Thanks, both. I've just noticed there's a comment here from Masal. I'm going to mispronounce your name, sorry, Masalko, saying that in the Concern Universal in Malawi are using sanitation as a carrot. It doesn't get much attention on the part of the community as it supports them with water supply improvement. So I guess in some cases I'm aware that this happened in other places as well, that sanitation is being used as the carrot to provide the water. We also have a question here from WaterAid. It's about the balance between citizen empowerment, capacity support and strengthening systems. This is from Vinnie Casey. Thank you, Vinnie. Do you see greater challenges for CSO efforts to strengthen accountability in the light of restrictions on civil society? Harold talked to that a bit about in your presentation. Do you want to elaborate on that, Harold?
Yeah, I'm trying to read the question. Do you see greater future challenges for CSO efforts to strengthen accountability in light of government restrictions on civil society? Yeah, I think it's always a difficult issue, and it depends on the political context in which we work. And there are some countries where, no doubt, civil society activities are more closely monitored than in others. So it's something to address probably collectively in terms of civil society being organised and represented to government at a central level. But there's no question that I think it's difficult to take this choice between being an outside critic and pointing blame at government, telling them that they're wrong, sort of trying to break down the front door approach versus, which I think personally in the long run is rather counterproductive, versus trying to work alongside and improve local government, and certainly not going against their systems and their approaches, but having enough space to be, if you like, a critical friend. So being able to point out areas where there should be improvement, to hold people to account in terms of their failure to meet commitments. And one very powerful part of this, and Vinnie knows very well more than most, I think, is the use of evidence. Even basic data around coverage and functionality to start with can be a very powerful tool to drive those discussions and to hold government to account. And we've got examples, I think somebody mentioned in the discussion from East Timor. I've just come from being in Swaziland, where there has been no data virtually on the even the location, let alone the status of systems. WaterAid with the government carried out a mapping exercise in the last couple of years, and that has had a huge impact, simply because for the first time people can see where are these systems, are they working or not, and what are we going to do about it? You know, why isn't government doing more to invest in maintaining these water supply systems once they're built? So looking at that data, using evidence, is a very powerful tool that I think governments can't then run away and hide from. I mean, it's there, it's on paper, and the reaction, I think, can trigger change and can trigger action.
Thanks, Harold. There is another question that's come in, which I think relates to a lot of the questions that have already been asked around local authorities, and it's from Andrew Jelansky at World Vision, and it's about rating systems for local authorities in terms of assessing local authorities' capacity to provide sustainable wash services, and how you might monitor over the course of a program any improvement to their capacity. I don't know if you have some examples where this has occurred.
I think there are,
in Zimbabwe, we...
Go ahead, Mark.
Okay, thanks. In Zimbabwe, we have a service level benchmarking report. It's done 2 years now, and they're doing the 3rd year. It doesn't directly support our project. Only 2 of the local authorities we work with are measured in that. But we would like to use the same service level benchmark indicators to measure changes in service delivery within our project. So that's something that we do plan to do, but we've only taken baseline figures at the moment. We haven't been able to measure changes or improvements over time as yet.
Yeah, I think there are, thanks Mark, there are examples of systems of trying to assess performance of local government, which I think is Andrew's question. And those are typically applied beyond just the water sector. So as I said in the presentation, you know, local government is typically responsible to provide a range of services. So I know of one such system in Malawi, where the local government ministry is working to establish, or has established, a series of performance benchmark indicators for local government, which is actually a very complex set of indicators. I think there's over 150 of them, and if you look down at those related to water supply and sanitation, you'll find some basic indicators around, you know, the frequency with which they've carried out their required reporting, some indicators around financial disbursements. So you can always, you know, improve those. They're rather process-orientated indicators, if you like. So have you done X, Y, and Z? But at least it's a start to see whether local government is actually fulfilling those functions, and then you can look at the outputs of those studies, and they want to carry them out. I think they are carrying them out on an annual basis to rank local governments, and then identify which ones are performing well, and they can be given further incentives. But also, I think very importantly, not just to sort of name and shame and then walk away. There's also a window of financing through the Ministry of Finance dedicated for low-performing local government. So it's important not just to rank them, but actually to try and do something about them. But I can send a link to that experience if Andrew is interested.
Thanks. Maybe we could go to a slightly different topic. There was a question about gender and inclusion, and also behaviour change for Mark. If you could talk to how you're addressing those issues in your project, Mark. Have I got everyone?
Okay, thanks. In terms of behaviour change, we are trying out the CLTS approach in the small urban centres that we're working in, and it's again the local authorities leading that process, and that's something that we've just started recently, and I couldn't really comment on the effectiveness or success of that as yet. Just to suffice to say that it's quite different than the CLTS in a rural setup. In terms of gender and social inclusion, we did some training with all the local authorities, and the content of that training looked a lot around auditing water and sanitation hardware using some of the water aid tools, and just looking at access for pregnant mothers, for disabled people to use the different pieces of infrastructure, whether it's a borehole pump or a toilet. And like we said, there's been some quick wins after that training, and again that's being rolled out in communities through the different what we call GESI champions, gender and social inclusion champions.
Thanks for that. I'm just scanning through the questions. Mark and Harold, feel free to as well to see if there are particular topics you think we haven't yet touched on there. There's a few kind of duplicate questions.
What would be nice if the organisers, if the attendees could put down in that question box also the any topics they think are particularly important for the workshop, although I suspect that there are more people who are not going to be attending in Harare next month than are, but it would be useful for us as well as looking at the content of the questions. So if you're going to come to the workshop, please just type in what you'd like to see addressed, and we'll try and be as demand responsive as possible.
Yeah, thanks for bringing that up at this point, Harold. That's a good point. We've got 5 minutes to go. I also there is a question there we haven't touched on, which is about subsidy challenges and communities. It says communities are demanding to provide wash facilities, so I assume they're seeking some kind of subsidy. So you talked in your presentation about giving voice to the poor, Harold, and that question of how you build in subsidies when you're working with local government, and how you decide at what point that's required. If we could talk to that a little bit more, perhaps.
Sure. I mean, I think the question of subsidies has become almost a dirty word. I think pushed partly by the approach of CLTS, which has had a massive impact in the last 5-8 years, to say that we shouldn't give subsidies, which personally I think maybe the jury is still out on whether that really works in terms of sanitation provision. But in global terms, talking about subsidies, I think we've got to realise that we're talking about water and sanitation. These are fundamental and now human rights, actually, not just basic services, but actually a human right. And if we look at the history of our own countries in the north, or my own country, or the US, or other countries in Europe, we'll see that public subsidies at various levels and at various points have always played a role. So even today in my own country, there are special tariffs for low-income people. So if your salary is below a certain level in the UK, you get a reduced tariff on some of your basic services. So I think that's what I was alluding to in terms of the public financing. It's a bit like the elephant in the room. Unfortunately, many of these countries, I think particularly acutely for Mark and colleagues in Zimbabwe because of the recent collapse there, there's only a finite amount of money to go around, and then that has to be decided upon. Does it go to health, education, normally getting the lion's share, defence, of course, spending is often high. So you only have so much public funds to go around, and then the rest has to be found either from tariffs or from international aid transfers. There are other mechanisms like raising money on the capital markets, probably only for bigger systems where you can raise bonds and so on, and there are some other innovative financing mechanisms. But ultimately, I think we have to accept that some form of subsidy is required, that it's not a dirty word, that we should be open to talking about that. The question is, where do you put that in terms of identifying those that are the most needy, and that relies on having a fairly rigorous and fairly systematic way of assessing income. You can do it in a participatory way, but at large scale. And in some countries in Latin America, I know that there are, systems in place which identify households as requiring such subsidies. So I think let's not shy away from that debate, that we should think about subsidies. The question is, how are those delivered? And local government would have a very important role in helping to identify the sort of most needy people living in their jurisdiction.
Thanks for that, Harold. We are almost at the end of our hour for our webinar. There have been a lot of really good questions, and we apologise if we haven't got to your particular question within the hour. We've taken note of your name and your question. If we haven't got to it, we'll attempt to respond separately on an email. Again, if you do have questions or topics that you particularly like to explore further, feel free to email me. Harold, perhaps you'd like to give some concluding comments, and also you, Mark, after Harold.
No, well, thank you for your participation. I mean, I think this kind of debate and the fact that the Australian AIDS program being managed by DRM is investing in these kind of discussions and promoting this kind of reflection, I think is very important. So this is a further sign, and as we've seen from the Zimbabwe case, that it's not just about people coming in from the outside with a lot of resources, building stuff and then walking away, because eventually the money will run out, and the CSOs will have to pack up and go home, or they'll retrench their programs in a country. So I think it's very important that as part of this process we are having these discussions, that we're recognizing that ultimately it's the sovereign entities in a country which should be taking the lead, and we can do a lot to help them, and there's a lot of good innovation going on out there and good learning, but let's not forget that at the end of the day it is the government and the local governments that are in place and have those ultimate legal responsibilities. So it's refreshing, and it's great that DFAT has invested in these kind of events. So we look forward to the next stage in Harare and continuing some of these discussions, getting into some of the more of the detail, and please, for any of the CSOs that are coming to Harare, we'll be sending out some requests to bring some information and some learnings from your programs. Over to you, Mark.
Thanks. No, I think from our perspective, obviously the design of the project that we have put together, it's quite specific to the context of Zimbabwe, and we think that that's important in your design. But that, yeah, fundamentally we're seeing that we think more and more WASH projects will go like this, where you really have to support government and whoever's going to be maintaining systems long after the project is finished. You have to really engage them from the start, and where possible you implement through them, like we're doing in the SELF project. I think from donors' perspective, this is going to be a growing theme over the next few years, and while there is a focus on results and outcomes, like Harold said, I think the general public isn't happy with a project which collapses after a few years. And this is something that in Weltunga we are particularly interested in, and we actually have a workshop which is taking place at the end of next month, which WaterAid and at the end of this month, sorry, which WaterAid and AquaConsult are taking part in, which really looks at post-implementation monitoring and how to ensure sustainability of the work that we do.
Thank you, Harold. Thank you, Mark. And thank you to everyone who attended and participated. It's really excellent to get all that discussion happening. And as I've just put in the chat bar there, if you want to continue this discussion, feel free to email us on that CS Wash Online email address. The first time I typed it was incorrect. Please use the second time. And then for those who are within the Civil Society Wash Fund, there we do have the ongoing e-discussion on this topic, which if you are a member of the Wash Fund, you can log in and continue the debate on the e-discussion. So thank you, everyone. I think we are finished. Yeah, thanks for your participation and have a good night or morning or rest of the day, wherever you are in the world.
Bye for now.
Thank you.
Bye-bye.
Okay, bye.